Hey guys, this is Dr. Hub. In case you haven't subscribed, please do subscribe to learn and grow daily. Now we're going to look at some important inheritance pattern. So let's look at some important pattern of inheritance. Pattern of diseases. So let's cover from the smallest to the biggest. So the smallest of them all will be the X-linked dominant. So the mnemonic here is nothing but a red rose. Red rose for all children. So this is the mnemonic. So let's break this down. So R here stands for the Rett syndrome, and another R stands for the rickets. So rickets as well as the Rett. Next, the A. The A stands for the Alport syndrome. Then comes the C. The C stands for the type X Charcot-Marie-Tooth disease. So the type X of the Charcot-Marie disease. Marie-Tooth disease. So let's draw teeth as well. So X-linked dominant is going to be red rose for all children. R stands for the Rett syndrome. Another R rose for the rickets, and A for the Alport syndrome, and next the C. C is for the Charcot-Marie-Tooth disease. Next, moving on to the others, the next smallest will be the X-linked recessive. So under X-linked recessive, the mnemonic will be LH college girls don't care about foolish words. So this is the mnemonic. The LH college girls don't care about the foolish words. So let's break it down. So the L here stands for the Lesh and the Love syndrome. So Lesh-Nyhan. So Lesh-Nyhan syndrome. Next will be the Lowy syndrome. Next, H. H is for the Hunter syndrome and the hemophilia A and B. So Hunter syndrome as well as the hemophilia. So this includes A and B. Next we look at college, that is C. The college C stands for the chronic granulomatous disease. Chronic granulomatous disease. So to recap, L was for the Lesh-Nyhan syndrome, L for the Lowy syndrome, and H for the Hunter syndrome as well as the hemophilia A and B. And we also discussed the C is for the chronic granulomatous disease. Next, we look at the girls, the mnemonic girls, G for the G6PD, G6PD deficiency. Next, we move on to the D. The D, it stands for the Duchenne muscular dystrophy as well as the diabetic insipidus. So D for the Duchenne muscular dystrophy. So Duchenne muscular dystrophy, and DI stands for the diabetes insipidus. So D is don't care about foolish words. So D for douche. So Duchenne muscular dystrophy as well as the diabetic insipidus. So care for the I. So care for the color blindness. So girls don't care about the foolish words. So C for the color blindness. So to make it easier to understand, let's draw an eye. So color blindness. Next, moving on, let's talk about A. So A is for the about foolish word. So A for the A gamma globinemia, A alpha gamma, not alpha, it is A gamma globinemia, globulinemia. Next, there is also the Alport and the ocular albinism. This is about. So the care about foolish words, A for A GABA globinemia, Alport syndrome, as well as the ocular albinism. Another ocular feature was about color blindness. So next is foolish words. F for the Fabry disease. Foolish fab. So Fabry disease. And words is for the Wiskott-Aldrich syndrome. Wiskott-Aldrich syndrome. So let's look at some other conditions. Other conditions, it includes the Menkes disease. Other conditions include other Menkes disease. Next is the ornithine transcarbamylase deficiency as well. So this was all about the X-linked recessive. Now moving on, the next smallest one will be the autosomal recessive, and a very easy mnemonic, AR. So autosomal recessive, the mnemonic is going to be ABC, DEF, as well as GHI. So now let's break it down and look at what is ABC. So A here stands for the ataxia telangiectasia. Next, there is also the albinism, there is the alkaptonuria, and there is a autosomal recessive polycystic kidney disease. So all these comes under A. Next, moving on to B. So B is where there is a blood disorders. So B for the blood. The blood disorders, it includes a beta thalassemia. Next, there is also the sickle cell anemia. So beta thalassemia as well as a sickle cell anemia. Next comes C. So what happens to C? The C is for the cystic fibrosis, as well as cystic fibrosis being a very important disease. So cystic fibrosis is AR, autosomal recessive, as well as a congenital adrenal hyperplasia. So it is also in short known as a CAH. So we finish the first segment, that is ABC. Next, moving on, we'll look at what is DEF. So DEF. So D for the deafness. D means deafness. Let's draw the ear. So we draw many eyes in the X-linked recessive. So I for color blindness, as well as there was a ocular albinism. Now looking at DEF, we look at the ear. The ear, there is a sensory neural. So sensory neural deafness was seen. Next comes the E for the emphysema. So we also spoke about the emphysema. Emphysema is alpha antitrypsin deficiency, alpha 1 antitrypsin deficiency. Next is the F. The F here stands for the Friedreich ataxia. So DF, sensory neural deafness, emphysema, Friedreich ataxia. Next, moving on to the G. What is G? So G stands for the GHI. So GHI, the G stands for the Gaucher's disease. So it is a Gaucher's disease. So Gaucher's disease as well as a galactosemia. Gaucher's disease, galactosemia, as well as the GSDs, that is a glycogen storage diseases. Next is H. H is for the homocystinuria as well as a hemochromatosis. So homocystinuria as well as the hemochromatosis. Next is I. I is for the inborn errors of metabolism. So I for the inborn errors. So inborn errors for the metabolism. So inborn errors of metabolism, it includes the phenylketonuria, so PK, as well as the LSD, that is a lysosomal storage diseases. So PK, that is a phenylketonuria, as well as LSDs, that is the lysosomal storage diseases. So now what are the other conditions? The other conditions which can cause are, we are talking about the autosomal recessive. So autosomal recessive is where we spoke about the ABC, DEF and the GHI mnemonic. So the other conditions, it includes the Wilson's disease. Other conditions was the Wilson's. Next, there is also the sickle cell anemia, as well as there is thalassemia. So let's draw a few diagrams so that it is easier to memorize. So there is an eye with the KF ring, so it's a Wilson's disease. Next, let's draw a sickle. So sickle cell anemia. Next is also along with thalassemia as well. Then comes the SMA, that is spinal muscular atrophy, SMA, as well as the KS, that is a Cartagner syndrome. Next is, it also includes the sphingolipidosis. There is sphingolipidosis, and there is an exception, that is except the Fabry's disease. Except the Fabry's disease. So this is about the autosomal recessive. So quickly, let's look at the X-linked dominant as well. X-linked recessive. That is, we spoke about the mnemonic that the LH college girls don't care about foolish words. So other diseases which are associated with this X-linked recessive. So to highlight, it was the Menkes disease, as well as the OT, that is ornithine transcarbamylase deficiency. So these two are the diseases which are included, which are extra along with the X-linked recessive. So we spoke about the X-linked dominant, then we spoke about X-linked recessive, then we spoke about autosomal recessive, the mnemonic being ABC, DEF and the GHI. Next we'll be moving on to the autosomal dominant. So this AD, autosomal dominant, the beautiful mnemonic is going to be heavy dominant. So let's make this small. So autosomal dominant. So what are the features here? So heavy dominant, let's look at H, heavy. So let's look at the heavy mnemonic. So heavy dominant. So let's break it down. So in case of H, it is the hereditary spherocytosis, HS. Next, there is also the hypercholesterolemia. Next will be the hypertrophic obstructive cardiomyopathy, so HOCM, and the other one will be the Huntington's disease. So to recap, the hereditary spherocytosis, hypercholesterolemia, hypertrophic obstructive cardiomyopathy, as well as the Huntington's disease. So all this comes under the letter H. Next is E. The E stands for the Ehlers-Danlos syndrome. Next comes A. A is for the achondroplasia. Next is the V. So Y is just to an add-on for the mnemonic. So what is V? V for the von Willebrand's disease as the von Hippel-Lindau syndrome. So V for the von Willebrand disease and the von Hippel-Lindau disease. So just to recap, we saw the hereditary spherocytosis. So there is a H for the hereditary spherocytosis, hypercholesterolemia, HOCM, Huntington's disease, E for Ehlers-Danlos syndrome, A for achondroplasia, and VW disease and the VHL disease. So this was about the AD, that is autosomal dominant. Next, moving on, we spoke about the heavy mnemonic, then DOMI. So let's look at the next half of the mnemonic, that is DOMI. So it's dominant. So let's look at DOMI. So DOMI, the D stands for the dystrophic myotonica. This is not diabetes mellitus. It is dystrophic myotonica. And then comes O. O is for the osteogenic imperfecta, OI, as well as the autosclerosis. So D for the dystrophic myotonica, osteogenic imperfecta, and the autosclerosis. Next, we look at M. M is for the Marfan syndrome as well as the MEN. So M for the Marfan syndrome, and also it is for the MEN, that is a multiple endocrine neoplasia. And then comes I for the IP, that is a intermittent porphyria. To recap, D for the dystonic myotonica, and O for the osteogenic imperfecta, that is concerned with the bone. So let's draw a bone. So osteogenic imperfecta and the otosclerosis. Next is Marfan syndrome, M for Marfan syndrome and the multiple endocrine neoplasia. So all this is going to be the dominant, so autosomal dominant. Then comes, so I for the intermittent porphyria. Next is we move on to the NENT, N-A-N-T, N-A-N-N-T, dominant. So N here stands for the neurofibromatosis, and this can be type 1 and 2. Then comes the A is for the autosomal dominant polycystic kidney disease. So we call it as the ADPKD. And then moving on to the N is for the Noonan syndrome. So there are very few diseases with the letter N. So it is a Noonan disease. To watch more videos like these and grow daily, subscribe to the Dr. Hub channel.